I'm Dr. Philip with the 21st Century Laser Stem Regenerative Medicine Institute, and today we are doing this senior CrossFit athlete, Louise. She wants to get back into her CrossFit exercises and competition, and today we're doing some umbilical cord laser guided stem cell therapy for her degenerated C5-6 vertebra and other areas of her cervical spine, along with her osteoarthritic knee, pretty much bone on bone. And right now I'm using a laser guidance system to target and mark the areas of greatest inflammation where we're going to graft the cells. Stem cells will go to the areas of inflammation, so that's why we want to put it where the temperature is the highest, okay? So if you look here, this is an infrared thermometer I developed called a LaserMed infrared thermometer. We're going to start at our C1 vertebra. Can you see that? It's about 88 degrees, correct? Let's go to C1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7. C5, 6, 96.2. That is the area of greatest inflammation. That's where we're going to graft the cells, okay? So we're not guessing. This is under laser guidance. Again, stem cells go to the areas of greatest inflammation, all right? So what I like to do is, I like to use the acupuncture points because we know they're safe points. And we're going to do this into the paracervical spinal musculature. And in acupuncture they call it one chun, which is 2 finger lengths lateral. Let's reconfirm those points. 96, 96.2, 96.7. These are areas of greatest inflammation, okay? So our stem cell anesthesiologist, nurse practitioner Michelle has just prepared the cells. Did we have 1 cc bicarbonate yet? Okay, so we have 4 cc's of umbilical cord blood mixed with 1 cc of bicarbonate, because bicarbonate makes an alkaline environment and cells thrive in an alkaline state. So that's why we're mixing it with the sodium bicarbonate to make an alkaline environment for the cells to proliferate better. Okay? We are going to do this with cryotherapy. This is a topical ice spray. We don't like to use lidocaine, that might damage the cells. So this will anesthetize and numb the skin while we graft the cells. I'm just going to put a perpendicular right in the lateral C5-6 joint space and paraspinal musculature. That's good enough. Put about 1 inch. It's not as much muscular in the cervical spine and lumbar. And we're going to graft half cc left, half cc right. Yes. You know what? Just give her one left, 1 right. We have extra cells. Yeah. Get a bandage ready?
No.
I got it here.
Okay.
All right, so we call that the bloodless. As you can see, not 1 drop of blood. Mosquito bite procedure. Rarely do we get a drop of blood, and rarely does it feel more than a mosquito bite. How many mosquito bites was that, Louise?
100.
All right. Okay, that was a Texas mosquito bite. All right, but no blood. We're good.
Wow.
She's doing great.
It's really sore. Is it
Yeah.
stay like this?
You want, okay, here's the deal.
True.
The more pain and soreness, the better, because that activates the cytokines, the inflammatory process, which will activate what? The stem cells. So no NSAIDs, no ice, no turmeric for about a month, because we want the cells to be activated. So we will send her home with a light emitting diode. It's a home panel unit. This is the clinical unit, but she's going to get a smaller portable one, and that's going to help the pain and inflammation and actually cause some local heat to activate the cells as well.
Okay.
So that's going to be your pain friend after for your soreness, okay? All right. Let's go ahead and do the right lateral C5-6 inner musculature. Okay, and we're going to numb the area. I'm going to give some extra cryosphere, okay?
Yeah.
She's a CrossFitter, she could take it. All right. Right C5-6 paraspinal musculature. Pretty much the splenius capitis, levator scapula, trapezius taliens. About 1 inch is good enough, and we could put another 1 cc of cells, approximately. Lateral to the C5-6. Barrier. Look, not a drop of blood. We just put that on just to keep it sterile. How many mosquitoes? Less than the other one? About the same, a Texas mosquito. Okay. All right, so now what we're going to do to augment the cells, to activate them, is I'm going to do some myofascial release therapy with these tools called laser edge tools. And this actually spreads the cells around so they don't clump up in one area, causing pressure. And it also breaks up a lot of the scar tissue and adhesions that interfere with circulation, nerve transmission. This will actually temporarily irritate the musculature around the neck
Sure, why not?
to activate the cells. So I'm biohacking your body's system to cause acute local inflammation, which will activate the healing processes, and not only keep the stem cells in the target area, which is around the C5-6, but actually create a homing signal so your body's dormant stem cells, they are activated. They will assist the fresh stem cells, day 0 old stem cells, because they're umbilical cord derived, to work together. So you're getting a whole cascade of healing processes. And there's the man himself. This is our medical director, Dr. Landero. 50 years medical internist, pulmonologist, and geriatric specialist. He's really the Wizard of Oz behind the whole operation, okay? Yeah. Probably feels good, doesn't it? Just spreading it around.
Kind of,
Good.
sort of.
Yeah, so Louise actually had some pig bone grafting in her cervical spine, but it caused more stiffness, more pain, because the spine's designed to move. And we don't want to have the titanium screw fusion, so we want to prevent that by actually creating more vascularization of the cervical spine, because the cord blood stem cells actually have 2 types of stem cells. One is the hemopoietic stem cells to make more blood vessels, and the spine is actually, when it gets degenerated, has a poor blood supply, so it cannot deliver nutrients, oxygen, glucose to the cervical disc, the surrounding nerves, the myelin sheath, all the musculature. And without the blood supply and oxygen, you get hypoxia and cell death of the tissue in here. So that will deliver the nutrients and oxygen. And the mesenchymal stem cells, those are more primitive, so that can actually help regenerate, the disc tissue, the myelin sheath around the damaged nerve, the muscles, tendons, ligaments, all the soft tissue support the neck. And then we're going to work, once our pain inflammation is under control, you could see the skin's getting a little red. We're causing a little acute inflammation. Then we're going to work on some rehabilitative exercises. And this is the real secret to our success, is we put this light emitting diode panel over her neck, and what this does is it's going to, I got you right here. It's going to bioactivate the cells, keep them warm, incubate them so they stay, they repair, they regenerate the tissue, and they also replicate, because the photobiomodulation from the 630 nanometers of the light emitting diodes is a regenerative wavelength. So the cells will incubate to grow, and that's why I give all my patients a home unit so they don't have to drive or fly here and waste money having to do the light stim therapy. They could do it at home, because my goal is to make this a one-day procedure, and that way we can treat people literally all around the world. It's only a 1-hour procedure. Okay, so we're going to let this cook for about 20 minutes, and then we're also going to do the knee procedure the next time. Okay, so actually Dr. Landero had his C6-7 procedure done
Same thing, yeah.
about a month ago. How are the results? Because
Feel better?
yeah, and you're having some radiculopathy down your
Yeah,
arm.
they
How's
still
that?
have some stiffness on this side,
Uh-huh.
Okay.
but which, you know,
Well, you're
after
feeling
the
better than
heat,
before.
after the heat treatment there, I feel better.
And your neck pain is how many % better? The neck pain itself?
Gone down a lot, you know, like probably 8, 9 before. Now it's 2
Wow.
to 3.
And then you also had some numbness, trigeminal
Yeah.
neuralgia.
You know, I usually have what you call hyperparesthesia on the affecting the trigeminal nerve, which is actually the submandibular area, submaxillary
Now we're
area
gonna do your knee.
of the
And this
trigeminal
time
nerve,
You're gonna go on the table.
numbness and hyperparesthesia. Now it's gone.
Wow.
You know, so I think it's actually more of regeneration.
Absolutely.
You know,
Of those tissues which
Repair.
were non-functional and now it's becoming functional once again and the problem is
Yes.
disappearing.
And you put your knee
Fantastic.
over this roll. Right? This is gonna go up and support your upper body. So we're gonna do the knee procedure, and we're gonna biohack the body's regenerative processes in several ways. First of all, we want to get the patient as comfortable as possible. That's why I like to use a very flexible table. This is a KDT Neuroflex high-low decompression table. I've actually developed a way to not only decompress the spine, but also the knee joint. Okay, and the way we do that is, I have this, I call it the ski boot. It's actually an anti-gravity boot. Toward the back of the neck. Let's confirm we are repairing the correct knee. This is the knee we're correcting, right? You'd be surprised, out of some knee replacements, sometimes they replace the wrong leg. They don't confirm. So now they make you sign not only the surgical contract before the knee replacement, they make you sign on your knee to confirm that that's the knee you want replaced, right? So we're confirming that this is the knee you want regenerated.
That's the name.
Yes. So yeah, you put it on pretty much just like a ski boot, nice and snug. It's not going to be very comfortable, just like a ski boot, but this is what it takes to get the results we want. I align the hook to the tibia. Is it nice and snug?
Yeah.
Comfortable, relatively speaking.
Yeah.
Okay. So what I'm going to do is I'm going to raise the high-low table so that cable is in line with the knee joint. Hey Ben?
Yeah?
I need the handle for the knee decompression. This will also make it more ergonomic for our stem cell practitioner to graft the cells.
Will this make me hard?
It may, once we grow a quarter inch in your few centimeters in her knee, yeah. So she has a little genu varus, which means just slight bowing of the knee. So we're gonna pull this on a obtuse angle, which will pull the joint, open up the medial joint. Okay. So I'm going to do about 30 pounds, which should be enough to decompress the knee. I'm going to hold it for 99 seconds. And let it decompress just for a couple seconds. Really open up that joint. Hold 99. What it's going to do when it tractions out the knee, it'll hold 99 seconds, which gives us enough time to inject the cells when the joint is decompressed, because it'll literally, we've filmed this under ultrasound. The bone-on-bone knee will, the decompression will create a gap, so the needle literally goes in like butter. Plus it creates negative pressure, like a suction mechanism, so the cells get sucked into the medial knee, and that's what we want. So I'm going to go ahead and we're going to mark our grafting points, again through laser guidance. The medial knee is our target. You come closer. Yeah. So the medial inferior knee is about 84.2. Superior 86.6. So we're gonna graft them in this medial superior, and in general, you're gonna have more pain and inflammation in the point of greatest temperature. In general, do you have more pain like in the upper part of the knee or below, or the whole area?
It's actually from the outside, and now it goes across
Okay,
top.
but it starts around this side, correct?
Yeah.
Yeah. And do you have more pain like is this more tender up here or here? About similar. Here or here?
The lower one is sharper.
Okay. Do you usually, let's say you're doing box jumps or squats in CrossFit. Would you feel the pain more down here or up here, or just both?
Probably it's the inside inside of my knee.
Yeah, that's what we're targeting,
Yeah,
but
yeah.
I want to know, do you feel more pain in the upper area or lower, or just both, upper and lower?
Both.
Okay, so we're going to graft. My superior point is my favorite because the patellar fat pad is out of the way. Everyone has a patellar fat pad.
Just 86, right? 8.6 and 8.4.
Yeah, so this is 86.6, 84. This is going to be a point B. In case this capsule gets full, we could put the remaining cells in the second choice, but our first choice is superior. And we're going to go, you see that divot here? I'm just going to go a little superior. You know what, use my green point. Okay, use the green point, see that divot? And we're going to go pretty much this angle, a little inferior, not totally perpendicular like this. I want you to feel that, go ahead and feel that, so you know where you're going. Yeah, and this one we'll do just like that, okay? Let's go ahead and do that. Let's put 1 cc here because we have extra, and then 1 cc here, okay? Do this one first. Don't tell anyone else I'm giving the extra cc. It's only because you're a fellow CrossFitter, okay? All right.
I went yesterday.
Okay, cryo spray, please. Hey, Doc, could you hand me that cryo spray? Great. Doc was here when we treated the Filipino professional rock climber, and the guy was built like a rock. You know, he's like, he looked like one of those American Indian, like, you know.
Hulk.
Yeah, he was like, wow, biggest Filipino guy I ever saw. But Doc was out of it because he was like jet lagged. So we're gonna graft the superior 1 cc with cryo spray. There you go. instance, good. She has a lot of space, huh?
Just fine.
That one real smooth. Do you feel that stretch, Louise?
Yeah, I do.
Good, perfect.
Okay, tell me exactly what movements can and can't do. I know I can't do wall balls because you know I have to look up with my neck.
All right, so here's what I want you to do. Let's, for instance, you know, I know how it is that you want to do your workout of the day. You gotta get that wad in. You have to scale it back to your ability. So let's say, you know, the workout of the day is 100 air squats, right?
Yeah.
Right. Now let's say you can go down 50% and there's no pain at all. I'll allow you to do that. What I don't want is high impact, shocking movements like box jumps, running, but you know, movements you could control that don't require any, you know, plyometric stuff, that's fine. Okay, we'll go over it after.
Okay.
Okay, now we're gonna do the lower inferior medial joint.
Oh, it's working already.
Yeah. Okay, and we're gonna go about this angle. Just go right in the capsule. Yes, perfect. Yeah, that's more arthritic down there, isn't it?
Mm-hmm.
Do we need the fan? Is that good?
Well, it's going.
Good.
Now it's filling up, so I'll fan it a little
Alright.
bit.
So once that part of the capsule is full, we'll pull back, go it on a different angle, and that way we can get the cells into other parts of the capsule. Because when you have bone-on-bone arthritis, sometimes you get little crevices, and when you get full, you have to pull back and fill another space. And this way you get complete regeneration of the cartilage for more effective scaffolding of the new tissue.
Okay.
Okay, I'm going to swing this around.
There's the cap.
How many mosquitoes we got there?
Oh,
Our Texas
the whole
one, okay.
swarm.
All right, so what I'm going to do again, just like we did in the cervical spine, we are going to biohack the body to increase the healing processes, create more cytokine signaling, paracrine signaling, local acute inflammation. So the cells will adhere to the target tissue, which is the medial knee joint. We don't want those cells spreading around to other areas. This is spreading around locally. That feel okay, Louise?
Yes.
Okay, yeah. Let's also break up the adhesions. You can already see the skin getting nice and red, which means we're getting nice blood flow in there. It's kind of like a PRP reaction where it stimulates your body's platelets and growth factors and cytokines to go to the target area which you want to repair. So I have different shapes. This is the concave tool. That was the convex tool, and they have different contours, so we can treat different areas of the anatomy to make it more comfortable with the patient. This is the knee tool. And it fits. We could frame the patella bone and get a little deeper to our target tissue. It probably feels a little more forgiving than the other tool, correct? All right. And this one's a little sharper, so you can get a little more specific right there in the femoral tibial joint. Get those cells going right where we want them. The medial side of the patellofemoral joint. medial meniscus, the medial collateral ligament area, the happy triad. Stimulate the patellar tendon. CrossFitters, they do a lot of jumping, box jumps, which is going to load the patellar tendon. So we'll do some release on that while we're here. Feels good, right? That feels good, you see. So it's almost like you could think about we're doing arthroscopic surgery from the outside, but we're not going in and cutting and taking things out. We're just releasing and breaking down the adhesions from the outside with the 440 stainless steel tools I've developed and with the aerospace engineer. Originally, the original design was designed by David Graston, thus the Graston technique, but it gets slippery. I redesigned the tools so they're more smoother, and it actually has a grip, and that way you don't have to white knuckle it, and it's more comfortable for the patient, so you don't have to rub as hard. So I call these my laser edge tools. They are molded by a laser, and we use them in conjunction with our light emitting diode lasers. So we're just going to put this light emitting diode on the medial knee as a 630 nanometer wavelength, which is the regenerative wavelength. It has a little heat. Again, it augments the acute inflammation. It's going to activate photobiomodulation. In layman's terms, it's just like when the sun, there's a photobiochemical reaction when it hits your skin, makes vitamin D3, or 1,2,3 dihydroxycholecalciferol, 1,2,5, to create it stimulates vitamin D3, and the process is where calcium is drawn into your bones and joints to make them stronger, stimulates growth hormone. This pretty much does the same thing to augment the regeneration of the medial meniscus and the cartilage. Right? So the cells were actually defrosted in this panel. Not only does it defrost the cells gently, this 630 nanometer wavelength bioactivates those cells. So when you put it in your body, those cells will look for that homing signal, because again, we want the cells to stay to the area of repair. Our goal is the medial knee joint. So again, this was done under knee decompression. So these are ways we make it more comfortable for the patient, biohacking your body to stimulate the healing processes, and again, to repair the target tissue, regenerate the tissue, and augment the cells to continue to replicate, the 3 R's, okay? Repair, regeneration, replication, because we want the cells to continue to multiply and divide. So, just like, I'm not going to sell you a pot of plants and not tell you to put it in the sun. You need water, CO2, nutrients, soil. Most important thing is the light, photosynthesis. Okay. So we want to photosynthesize the cells, the cartilage in your knee, all right? Get you back into CrossFit, all right? We'll see you at the next games, okay?
Yeah, right.
That's how we do it. Thanks for watching.